and just exploring, especially in these times, but really always when we're supporting people and working with people. Um, because I think, it's just one of the most challenging things to be doing. And again, during this time of the pandemic, and we'll talk about that a little bit more later, I think it's especially true. And, a lot of this material that I'm going to be talking about is things that I'm sure that you've heard. And that isn't, going to be anything really new to people, but it's really important, I think, to keep it in mind and, always kind of be reviewing it. So I'm really glad that, that you guys are here. I'm really grateful to be sharing it. And so before I start, I want to, that poll that Deb was talking about, I want to get a sense of, since we're not able to be in the room together, I want to get a sense of, who's out there. Who's out there listening, and how are you supporting people. So Carrie, if you can go ahead and put up that poll. So see, there's the poll. So it's talking about kind of what your role is. So what's your role as a caregiver? Are you a paid caregiver, an unpaid caregiver, or a parent, or a person who works with and supports caregivers? So let's take a couple minutes and go ahead and fill that out. Isn't that cool that it just goes up as you're doing it, right, in this virtual world? And knowing that, of course, there's so much that this, doesn't get specific about. Nurses, case managers, social workers, clinicians. There's a lot within that, but it'd be interesting to see who's out there. It's looking like we're getting there. Another minute here. Are we thinking that's everybody? Looks like it's still creeping up a little bit. And we can be more than one at the same time, right? So it's looking like it's settling down here a little bit. So it looks like, most, if not everyone out there is a person who works with and supports caregivers. So whether that be a care manager, a nurse, administration clinician, and it looks like there's, 15% are parents. There's a little bit, 5% of unpaid caregivers, and then paid caregivers is also 5%. So that, that's a good idea of who's out there again. So thanks for doing that. So we can stop sharing that. Do I need to stop doing that, or can Carrie do that? There we go. Okay. So, all right. So let's just get into it here. Okay. So before we can get into compassion fatigue and kind of understand that a little bit better, let's think about compassion. So what is compassion? A feeling of deep sorrow for another who is stricken by misfortune, accompanied by a strong desire to alleviate suffering. And so, I think that we all, of course, do that. We get into the field for a reason. We all have this compassion. But the big key here is we can feel deep sorrow or compassion for another, but the difference with compassion is that it's the strong desire to alleviate that suffering, right? So we not only can feel for another, but we want to actually do something to help. And that's the piece that can get, just really exhausting and can take a lot out of us. So compassion fatigue. What is that? So that is stress resulting from helping or wanting to help people who are experiencing trauma or suffering. So here, this mentions trauma. And, I don't know, many of you I know have, I do a lot of trainings on trauma and trauma-informed care. It's kind of my specialty, especially with people with intellectual disabilities. And, when we talk about compassion fatigue and vicarious trauma, some of these other things I'll mention later, we're talking about supporting people that have experienced trauma or suffering, but really, when you think about that, most of us, all of us have experienced some type of trauma. And I think we know, that the people that we support, people with developmental disabilities, other types of disabilities, people who are in vulnerable positions, and the statistics on experiencing trauma is just off the charts. I mean, they really are some of the most vulnerable to experience trauma, whether it be big T or little t trauma. So I just wanted to mention that. So the term compassion fatigue was first coined in 1992 when a registered nurse, Carla Joynson, described a unique form of burnout that affected caregivers and resulted in a loss of the ability to nurture. This form of burnout, number one, was related to a variety of stressors, including long hours, heavy workload, and the need to respond to complex patient needs such as pain, again, trauma, and emotional distress. Number two, it resulted in nurses feeling tired, depressed, angry, detached. And number three was associated with ineffective performance. So this really all started with a nurse, kind of noticing this. And I know a lot of you out there are nurses. So I just wanted to mention that. So like I mentioned before, I do a lot of trainings on trauma-informed care. And I just wanted to, just to throw this in here and mention it, because I think it's really important to mention this, what is trauma-informed care? So what is trauma? According to SAMHSA, individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically and or emotionally harmful or threatening, and that has lasting adverse effects on the individual's functioning and or physical, social, emotional, and spiritual. So this is, stuff to kind of keep in mind. Trauma-informed approach incorporates realizing the prevalence of trauma, recognizing how it affects all individuals involved with the program, organization, or system, including its own workforce, resisting re-traumatization, responding by putting this knowledge into practice. Core principles of trauma-informed systems of care are safety, ensuring physical and emotional safety, trustworthiness, maintaining appropriate boundaries and making tasks clear, choice, prioritizing staff, consumer choice, and control. People want choices and options for people who have, especially people who have control taken away, which I think is, a lot of the people, if not all of the people we support. Having small choices makes a big difference. Collaboration, and that means, not just with the people that we support, of course, collaborating with them on their care, but with the teams, and the providers that we work with. And then empowerment, prioritizing staff and consumer empowerment and skill building. So I wanted to mention this because I think it's important to keep in mind, especially given that, many, if not all of the people we provide care and support to have experienced some type of trauma. But I think we do this innately, this trauma-informed care, and practice these things innately as carers and nurturers, and it takes a lot out of us. So just practicing all of this really, and keeping it all in mind is really exhausting. So I really like this quote. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So I really like that, because if we think about, providing this type of care, doing this work, many people out there have, are caregivers and have someone living with them 24/7. I mean, we can't expect to care for someone on that level and not have it affect us in some way, especially in an ongoing kind of chronic way. And especially, again, during these times when, we've been with people 24/7. So I want to talk a little bit about empathy, because empathy is a big piece of compassion. And it's a big piece of who we are and what we do and why, it takes such a toll on us. So if we think about this word cloud, I liked this and thinking about, some of the things that go into empathy, right? Connecting, listening, feelings, safety, needs, alive, heart, compassion, communication, presence, being present all the time. I hear you. Dialogue, kind of engagement back and forth. Authenticity, which, can be hard. So empathy is a big piece. So I want to show this little video here, and let's hope all of this goes off. Yes, it will. So this is, I know probably a lot of you out there have seen this, but it's really, really short, cute little short video on empathy. And this is Brene Brown. And I don't know if probably a lot of you know who Brene Brown is. She's an amazing person, a social worker, an author, a researcher, professor, I believe, in Texas. And she does research and has books primarily on vulnerability and shame and connection and authenticity. And she actually, her TED Talks are wonderful. If you haven't, seen any of her TED Talks, especially one on vulnerability and shame, I highly recommend that. It's like, I think the top most watched TED Talk. But this is a little short talk she does on empathy, and they've kind of overcast it with this little animation. So I just want to show this.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, I'm down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So I really like that, excuse me, that little video. I don't know if people have seen that before or, want to share any thoughts or feelings they have on that. I really like that. One thing I really, like about it that she acknowledges in that is that to have empathy really and to connect with someone on that level, you really do have to tap into that feeling, that emotion, or something similar that you've had for yourself. And that, especially when you're a caregiver and you're doing that all the time, that can get really tiring, really hard. Okay. So thinking about empathy, again, a big part of compassion and the development of compassion fatigue is empathy. And there's 3 types of empathy here, right? The thinking or the cognitive empathy, the feeling, affective empathy, and the compassion empathy action, right? So that's where we want to actually do something to kind of make a difference. So emotional empathy, you feel awful, then I feel awful too. Cognitive empathy, I understand that you're feeling awful. That must suck, right? So that's kind of surface level, not helpful. And then there's compassion. You feel awful. I feel awful for you. How can I help? And as you know, again, as caregivers, as you know, providers, as professionals, that's what we do, right? Is how can I help? And like Brene said in that, sometimes helping is just being there and just listening rather than trying to fix things. And then trying not to do that is also hard work sometimes. Okay. So I like this little definition of compassion fatigue because I think it talks about kind of this dichotomy that you can have, or kind of this two sides of it here. So it can be emotional withdrawal, accompanied by mental and physical exhaustion after caring for sick or traumatized people over time, or apathy or indifference toward the suffering of others after overexposure to tragedy and pain. So this is kind of like, you know, the shutting down and, you know, just kind of that indifference, kind of that feeling of not caring as much, which is really, really different for us. But again, so they're talking about traumatized people. So you're going to find that within a lot of the descriptions, a lot of definitions, um, they're aimed a lot at people, primarily therapists or clinicians working with traumatized people. But you know, it's really not limited to that. And you think about, again, you think about traumatized people, that's pretty much most, if not all, of the people that we provide support to, and all of us really, because again, there's, you know, big T, little t trauma. And I think, you know, everyone's been traumatized in some kind of way. And it's not just sitting with someone in a therapy chair, right? It's providing support to someone that has experienced trauma, and it may not be their trauma story, but it may be, you know, how that comes out for them, whether it be in emotional distress, their challenges to regulate their emotion. It could be challenging behaviors that happen, you know, based on some traumatic experiences. So what are some of the signs? And I think probably a lot of us can relate to this um, and experience a lot of this stuff. So blaming others for their own suffering. So I think we can tend to do that. We can tend to kind of want to externalize things and kind of push our feelings off onto someone else. Even the people that we provide support to, you know, I mean, as a clinician, I think it's hard for, you know, people that have people living in their home, shared living providers. I think sometimes there is that kind of, because the person is this way, because and it really does affect them. But I think we also need to remember that that people are in pain. Complaining about your life and your work, I think we all tend to complain a lot, right? I mean, I think it's a way of coping. I think you know, there is this real true thing called negativity bias, and I think we tend to want to go to the negative first. It's kind of where our brain automatically goes, and we complain about things. And it takes a lot more work to kind of think about the positive. And we'll talk a little bit more about that later. Poor self care. And self care, again, so self care is kind of a buzzword, right? And we hear a lot about self care. And that can mean many different things for many different people. But I think it really is important for us to focus on stress, which again means many different things. Muscle tension. So if we think about, and we'll talk more again later, how we hold stress in our bodies and how that affects our muscles and our bodies. Escapism. This is one of my favorites, my personal favorites. Um, I I know that I'm getting overwhelmed and I'm needing to take, you know, a little space when I go and I'm looking on Zillow and I'm finding a house in, you know, say Arizona, and then I'm, you know, on Indeed and finding a job in Arizona and then in California. So I have all these little lives and all these different places, you know, and kind of create, and it's fine. Sometimes I'll give myself 10 minutes, you know, here and there throughout the day to do kind of stuff like that. Then we're finding that we're doing that a lot. I think that's something we need to take a look at. Struggling to concentrate, again, you know, in a lot of things we do, we can struggle to concentrate. Overeating, using food kind of as a coping or a way to regulate our emotions. Insomnia, trouble sleeping, and bottling up your emotions, right? And not kind of however it is you know, best express it. We got to get those feelings out. I think a lot of people tend to numb and use alcohol, food, shopping, you know, whatever else to kind of numb out our feelings. So here's by Figley, another pretty comprehensive, you know, list of symptoms of compassion fatigue. And again, you know, because you don't, this isn't an exclusive list, and there's a lot more to this too, but just some things to keep in mind. And I like this because it's kind of broken out into the categories. So cognitive, perfectionism. I mean, I think a lot of us tend to kind of have that perfectionism. Actually, Brene Brown has, you know, has written on that subject and has a book called The Gifts of Imperfection, and that's a really good book for perfectionists. Preoccupation with trauma. Again, you know, talking about trauma, kind of preoccupation. I mean, again, this is thinking about maybe therapists who hear trauma stories and kind of get preoccupied by those stories. Spacing out, I think that happens a lot. A loss of meaning, you know, why am I even doing this? Kind of existential crisis, which I tend to have every couple of months. Self-doubt, minimization, it's no big deal. Emotional powerlessness, anxiety, guilt, anger, rage, survivor guilt, you know, which is a real thing. So if, you know, we're providing support for someone and we know that they've been through, you know, a lot of stuff, there can tend to be like a, why did this person go through this? And, you know, I didn't, especially if it's a family member. Hypersensitivity, emotional roller coaster. I mean, I think we all have that, but I think when we're really vulnerable this way, there's a lot of kind of ups and downs that we can feel. Being overwhelmed, depleted energy, just exhaustion. And then some behavioral indications: impatient, withdrawn, irritable, sleep disturbance, trouble sleeping, hypervigilance, kind of, you know, jumpy, accident prone. I was thinking about losing things, or, you know, misplacing things. So before I worked at Nonotuck, I was a therapist, an outpatient therapist in an outpatient clinic for almost 20 years. And I did that for a really long time. And primarily with people with intellectual disabilities and, you know, of course, lots of trauma. And, you know, in the outpatient world, you see 7 or 8 clients, you know, in a day, boom, boom, boom. And boy, it really can get exhausting. And I can't even tell you, I can't even count over the years how many times AAA had to come and get my keys out of my car because you really just get that way where you're just losing things or forgetting things. And then spiritual. So questioning the meaning of life, you know, again, existential stuff, loss of purpose, lack of self-satisfaction, you know, are you making a difference? Is any of this even helping? Questioning religious beliefs, personal relationships, you can get withdrawn and start to mistrust, overprotective as a parent or a spouse. You get lonely. Of course, during this time, I think, you know, over this past year, I think that a lot of us have struggled with that. Physical, shock, rapid heartbeat, joint and muscle pain, dizziness, disorientation, impaired immune system, which, you know, is really important now, right? I mean, we need to be building up our immune system. And again, this is you know, not a comprehensive list or an exclusive list. You know, there's headaches, stomach aches. I mean, there's many, many more. I'm sure lots of you out there can relate to some of this um, and have felt some of this stuff. So I like this little graphic because, so when thinking about compassion fatigue, it's kind of a combination here. So, and we'll go into, you know, what secondary trauma or vicarious trauma is in a minute. But so when we think about burnout and secondary trauma, and again, I'll go more into it, but burnout really is kind of your general vocational stress or your general kind of stress or, exhaustion from work, and it can be kind of any work. Whereas secondary trauma, again, is primarily around, being exposed to, someone else's trauma and on an ongoing basis. And again, it doesn't have to be in the therapy chair, but it's kind of those things together that create this compassion fatigue. It's kind of the compilation of that. So here, this just kind of sorts out the kind of different definitions and kind of compares them a little bit. So secondary traumatic stress refers to the actual presence of PTSD, post-traumatic stress disorder symptoms caused by at least one indirect exposure to traumatic material. And again, traumatic material can be lots of things. It doesn't necessarily mean you're hearing someone's trauma story. It could be, that ongoing kind of emotional distress they have, or just the challenge of keeping up with some of their behavioral struggles. And then there's also several other terms that capture this and can be interchangeable. So again, compassion fatigue can be a less stigmatizing way to describe secondary traumatic stress and has been used interchangeably with the term. Vicarious trauma refers to changing the inner experience. Again, this is talking about the therapist, but really anybody providing support resulting from empathic engagement with a traumatized client, right, or with a person that needs support. It's a theoretical term that focuses less on the trauma symptoms and more on the covert cognitive changes. So it's kind of this is kind of how it changes the way that you think about yourself and how you think about the world. Feelings of safety. And it can occur following cumulative exposure to another person's traumatic material. So again, this is kind of a thing over time. This is cumulative. And burnout is characterized by emotional exhaustion, depersonalization, and which is kind of not feeling quite yourself or outside yourself, and a reduced feeling of personal accomplishment. So again, I'm not helping here. While it also is work-related, burnout develops as a result of, again, general occupational stress. The term is used to describe the effects of indirect trauma exposure specifically. But here's where, I like to kind of flip the coin a little bit and, again, get away from some of that negativity bias and think about how this type of compassion, this type of work, and this type of supporting people can actually help us and make us better and satisfy us. And so in thinking about that, we want to think about compassion satisfaction. So this refers to the positive feelings derived from competent performance. Again, this is talking about trauma professionals, but is anyone that supports people. It's characterized by positive relationships with colleagues, with the people we support, and the conviction that our work makes a meaningful contribution to the people that we support, society, communities. So this is what we want, right? We want this compassion satisfaction. So this is kind of a complex slide a little bit and kind of a complicated little chart, but it really is just kind of a visual way to look at how compassion fatigue isn't, it's kind of this cumulative over time, the way that's kind of process works to develop compassion fatigue. So you have the exposure to suffering, right? And then you have your concern about that. You have your empathic ability, and then your empathic responses. So it's kind of how you respond to people. And then you get your detachment, so you can get a little bit detached. And then your sense of satisfaction, residual compassion stress, prolonged exposure to suffering. So it's kind of continues down and you're chronically exposed to the suffering. And then you might have your own traumatic memories, right? Or your own kind of adverse experiences that you've had that kind of course, play a part in this, because we can't kind of separate that out all the time. And then again, you have your other life demands. And during this time of COVID, this past year, we have a lot of other life demands, but it's all those things together that develop, aid in developing compassion fatigue. So how we doing out there? We doing okay? This is a lot of information and I can't see any of you. So just checking in. And if anyone has questions or comments, like Deb said, put it in the chat and I should be able to see it pop up. Um, and if I don't see it and one of you guys sees anything, let me know. Okay, so here's some more causes or kind of things that contribute to the development of compassion fatigue above and beyond just caring for others. And I know that there's lots of you out there, and I know some of you in particular out there that can relate to some of this. So placing your needs, the needs of others before our own. I know that that happens a lot, right? I mean, I think that's the nature of we get into the field, right? Or, it's just who we are. Unresolved past trauma and pain. So again, I think a lot of us as caregivers, we have our own, trauma, our own pain. We come to the field for a reason. I think we're drawn to support and help others because we've been through some stuff. So that can contribute to it. A lack of healthy life coping skills. So I think, again, I think sometimes we do things that aren't as healthy, as maybe it should be to kind of cope, especially during this past year has been so hard. We might turn to, again, food or shopping or, having a few drinks every night or, just kind of things that can contribute to this. Lack of self-awareness. This is a big one that limits growth. So I think that a big piece, and, there's so much out there now with, podcasts and self-help books and TED Talks, and there's so much out there that can help us build our self-awareness. But I think we really need to take the time to focus on that and to really, really bring it to the forefront, because I think that when we're not working on our, being aware and self-awareness and how we're responding to things, we can get caught up in this and it limits our growth. Giving care to others under stress, right? Which I think we all do all the time, especially recently. Lack of personal boundaries. And so I wanted to mention boundaries. And I think boundaries is one of those, again, kind of a buzzword thing, but I want to be careful about boundaries a little bit, because I think as professionals, we can use boundaries to kind of keep us at a safe distance from people, which can get in the way of real, authentic kind of engagement and connection. And so I think that we got to be careful when we think about boundaries. So when I think about boundaries, I think one of the most important things that I think about boundaries is establishing with that person, that you're supporting, what's okay for me and what's not okay for me, and what's okay for them and what's not okay for them. So you kind of have that, that boundary, but you're not, it doesn't need to be this kind of disengaged, not authentic kind of connection. And then the ability to communicate needs, I think, not only to the people we support, but to, our coworkers, our supervisors, the people that are administrators, people that are there to support us. We really need to be asking for help and letting people know when we need help. Okay. So, so I like this. So if we think about the professional quality of life, right? So, and again, it's not just professional, because I know there's people out there that are family members or unpaid, support to people. But if we think about quality of life, I like this graphic because we're thinking about it as like a scale a little bit, right? So on one side, we have compassion fatigue, which again is burnout and kind of secondary vicarious trauma stuff compiled. And then on the other side, we have that compassion satisfaction. So how do we kind of tip the scale, and how do we, of course, we want to increase our compassion satisfaction and reduce our compassion fatigue. So how do we do that? Well, first we need to kind of get a sense of where we're at. So this is, I know Deb had mentioned earlier that there was some handouts that were sent out ahead of time. So hopefully people got those. So this is the professional quality of life scale, the ProQual. And so if we can take just a couple minutes and, do those for ourselves a little bit. And then, so this doesn't have it. This was just to kind of cue me that it's time to do it. But there's
Kelly, it's also been added to the chat for people to, if they didn't receive it, they can go in the chat and get it there.
Great.
The handouts.
Thanks, Carrie. And then on the handout, there is a little way to score it as well. So you can just go ahead and fill that out and then score it for yourself. And then we'll just take a couple minutes to do that. Oops.
How do you get that to fill it out? How do you get that on your computer to fill it out?
So I guess, Carrie, you said that there was
In the chat, there is they've been added, the handouts have been added to the chat.
Okay, I'm in the chat. I don't see it though.
If you're able to select my name, Deborah Schneer, so that it is messaging me directly, I can attach them directly back to you. But for others, if you scroll up in the chat, you'll find 3 attachments. You can certainly message Carrie Parody or myself individually, and we'll send them to you that way as well.
Hold on, I'm looking. Is that the self-care plan one?
That's correct.
All right, so if I download that, right? Download it?
Actually, it's the Pro QOL. Deb added 3 attachments. The one that is currently being shown is the Pro QOL. It's the last one that she attached.
Oh, okay. So download that one, right?
Yep, you could just, yep. Click on that to download, and then you can
Okay.
click on that.
And if people are struggling to find it or fill it out, we can always, just kind of get an idea of where you think you're at. You can look at the questions and then fill it out at a later time.
Yeah.
I know, technology, right?
Yes, it. So I'm looking under, it ain't the D409, right? No, I don't think so.
I can send it to you directly. Is this John?
Yeah.
Okay, I'm going to send it to you directly now.
Okay, let me get out of there too.
Thanks, Deb.
What, to my email? Or
I think
right?
she's going to send it right in the chat. You can just click.
Oh, in the chat? Okay.
Can you send it to Latoya Gordon Hounds too? It's L Gordon. On the chat, I also can't find it. I'm sorry, you guys.
No, that's okay. That's okay.
So it should come.
Yep, I'm going to send it now. So we're just going to ask that participants keep themselves muted and send a message to Carrie or I in the chat. And we are just following up one by one with each one of you that send us a message. If you'd prefer it in your email, please just enter your email in the chat and we're happy to send it to you that way as well.
It looks like there might be a hand raised. If there's a question, you can go ahead and type it in the chat. Has anyone typed anything in the chat, Deb or Carrie, that you've seen? I'm just curious because
I don't see the chat.
Yeah, the people are just requesting that we send it to them.
Okay. And the reason I'm asking is because I don't think I can see the chat, because when I made my PowerPoint into a slideshow, that I can't even access the bar doesn't come up for chat.
Oh, okay.
So if there's questions that come up, just know that I can't see them.
Okay.
We'll just take a couple more minutes. And again, you guys can do these again at a later time to get a better sense of what I'm talking about here. But this is a nice little scale just to get a sense of where you're at with this. Again, between kind of compassion satisfaction and compassion fatigue. And it's nice to keep it and have it. And because it could change in a given day, a given week. It'd be interesting to see how people score on this kind of during the pandemic versus, hopefully when we're kind of out of this and things are a little bit more back to normal. As we're doing it, has anybody done it, completed it, wants to share? Were they surprised by their results, or have a thought or an idea where they might be on a scale? And again, I can't see the chat if people are writing in the chat.
Kelly, have some feedback in the chat that it depends on the day or the week. It changes regularly for folks.
Mm-hmm.
Others responding at a 110 on the scale.
Okay. Yeah, again, this does really change based on kind of and I mean, I tell you, during this time, the pandemic, I feel like I've had weeks where I was like over the top with this. And then weeks where it was like, whoa, this is pretty cool. I could kind of do this forever. So I think it really does, can really change. So why don't, just continue to, do this as you can, and we'll just move forward a little bit. And, again, ask if you haven't gotten that. Okay. So I really like this quote. I use quotes a lot in my presentations, but I really like this one. So do not sacrifice yourself to help others. Increase yourself to help others. Your service and caregiving is a gift that should be nurtured and preserved. Be intentional and diligent about your own self-care. So I really like this. I like the thought of, being in the positions that we're in, whether we're paid caregivers or providers or professionals, what we do and what the gifts, it's a gift that we've been given to be able to support people in this way. And I think part of our responsibility is to nurture that gift and care for ourselves so we can better care for others. So it's just really important to remember that. And again, you can't pour from an empty cup. You have to take care of yourself first. And, again, self-care and taking care of ourselves, it's kind of, a lot of people talk about it now. It is kind of a buzzword, but I think it's really just really important to remember. And I always love, of course, to use the whole thought of being on an airplane and, the flight attendant doing that whole kind of spiel up in the front and talking about, providing your oxygen mask to yourself first before the person you're caring for, before the person next to you, because you're not going to be any good, unless you take care of yourself first. And how do we do that? And what do we need to be, help ourselves in that way is resilience, right? We need to really work on building our own resilience. And what is resilience? Again, this is another word I think people talk a lot about, but it's an ability to recover from or adjust easily to misfortune or change. And I think that's really important to keep in mind, right? Because I think in the work that we do and the way that we provide support to others, we experience a lot of change and misfortune and, challenges along the way. So it really is important to build our resilience. Let me just, oops, sorry about that. Just need to minimize my picture here so I can see the words. Okay. So thinking about resilience practices and ways that we can build resilience, these are some of the things to keep in mind. Physical exercise, whatever that means for people. Sleeping, really focusing on healthy sleep habits and caring for our sleep. Mindfulness, we'll talk more about that. Reappraisal, emotional savoring, so really kind of savoring our emotions and savoring the things that we experience. Gratitude, again, we'll talk more about that one too. And social connections and contact. I think, again, during this time, it's getting better, right? I mean, I think we're seeing a light at the end of the tunnel, but, it's been really challenging. And a lot of the social connections has been virtual, which is, as we see, is somewhat limited. Okay. So mindfulness. Again, this is another word that people, talk a lot about, another buzzword. And, so John Cabot, this is a definition from John Kabat-Zinn. He says that mindfulness is awareness that arises from paying attention on purpose in the present moment, non-judgmentally. So John Kabat-Zinn is, for those of you, I don't know if everyone's heard of who he is a medical physician, a doctor who spent time, I believe it was like late 60s, kind of 70s time over in India, and really, really learning and practicing mindfulness and meditation. And then what he did was, he was really the first one to kind of pioneer and bring mindfulness to the medical community. And he brought it back to hospitals and, medical practices, and really developed a mindfulness-based stress reduction, which is a program that really does just that. It brings this kind of regular practice of mindfulness meditation to the medical world and to patients with heart disease and diabetes and all kinds of medical conditions, and really found that practicing mindfulness regularly really helps our bodies and really can make a difference in our bodies. And so when he talks about paying attention on purpose, right? So we have to do this on purpose and focus on the present. But the second big part of it, right, is non-judgmentally. So we have to, when we're being present in the moment, we have to not be judging whatever it is in the moment that's coming up, whether it be ourselves or, thoughts about people or what's around us. So that's a big part of it. I like this quote too. So mindfulness gives you time. Time gives you choices. Choices skillfully made lead to freedom. You don't have to be swept away by your feeling. You can respond with wisdom and kindness rather than habit and reactivity. So I really like that quote, especially for, care providers and caregivers. I really feel like part of what we can do when we practice mindfulness, one part of what we do as a caregivers is we are, constantly responding. So practicing mindfulness helps that space between, something happening and then how we respond to it. So it can kind of just help, lengthen that space so we can have more time and more presence to be able to respond differently, remain calm, all of those things, which can really, really help in our interactions with the people that we support and with anyone really. Okay, so we're going to do a little exercise here, a little breath exercise, really short, but I like this one. It just really is a way to illustrate how focusing on your breath, and this is one type of, one way to practice mindfulness, but really taking even just 1 minute of focusing on our breath and slowing down our breath, how that can really, really change our reactions and how we breathe. And breathing is really important because breathing, when we're really focusing on our breath and breathing deeply and getting enough oxygen to our bodies, to our minds, it can just really make a difference in how we are in the world. So what I'm going to ask you to do, so this is called a 3-stage breath. And this is going to take, about 3 minutes in total. So what I'm going to ask you to do for the first minute, and I'm going to time it here, is I'm going to ask you to you can either close your eyes if you're comfortable doing that, or just soften your gaze, or focus on one thing. And then I want you to just don't change your breath in any way. Just count your breaths for 1 minute. Just count how many breaths you take in a minute. And so we are going to go ahead and start. Okay, so that was a minute. And does anybody want to share how many breaths they counted? What they got for that minute?
Yeah, I did 14.
14, okay.
Yep.
Anybody else want to even write it in the chat, or?
We got a bunch in the chat. We have 15, 18, 12, 19, 9, 15, 12, 16.
I usually.
So there was question, inhale and exhale is 1 cycle equals 1 breath, right? So like breathing in and breathing out is 1 breath, correct? Like 28, 25, 14, 25. I was trying to count, but I mindfully lost what I was doing. So Kelly, are you saying, so how many inhales is it an inhale and an exhale is 1 breath? Is that what you mean? Oh, I think we just lost Kelly. That's okay, Karina. I think I overthink my breathing too.
I thank everybody for their patience while we work out Kelly's connection. I'm sure she'll join us back in a minute.
Am I back? Can you guys hear me? I'm not sure what happened. That was weird. I didn't lose signal or anything, so I'm not sure what happened.
You're back.
Sorry about that.
You're back.
Yay.
We got you back.
See, I guess it wouldn't be. Yay. I don't know what happened. All right. Let's see.
So, what we're not seeing right now, Kelly, is your PowerPoint. You might have to reshare that.
Is it back now?
Yep, it's back to the first page. So everybody was just responding to all the breaths that they took during that time.
Okay. All right. Let me just get this back to. There we go. Sorry about that. I'm not sure what happened. I was telling everyone, Deb and Carrie before, I said, I've been to a lot of trainings during this time, virtual trainings, and I don't think there was one where there wasn't some type of glitch. I think it's just par for the course, right? So I guess it was good. It was during a calm time. So do people, so why don't we, rather than share that right now, why don't we, we'll go to the second piece here, just to, and so what I want you to do for the second minute is I want you to slow down your breaths and really focus on taking really slow, deep breaths. So when you're breathing in, just really breathe in slowly and kind of fill all the way up. And then when you're breathing out, really focus on breathing out very slowly and emptying all your breath. So we're not counting our breaths at all during this time. We're just really focusing on slowing the breath down. So let's start doing that, and go ahead and start now. Okay. So that was a minute. So now we're going to do one more round here. We're going to do, for the last minute, what I want you to do is count your breaths again. I don't want you to change them or manipulate your breath in any way. Just again, for 1 minute, count how many breaths you're taking. Okay. And go ahead and start. Okay, so what I want you to do now is notice, was there a difference between the numbers, right? So in between when you first counted your breath, and then we changed our breath, we slowed our breath down, and then the second time, does anybody want to share their numbers? What was it different?
Got someone who went from 12 to 8.
Yeah.
Actually, almost in half, from 13 to 7.
Yep. Yep.
John went from 14 to 9.
Wow. Excellent.
25 to 19, 12 to 9. Everybody seems like they're going down.
Nice. Nice.
21 the first time, 5 the second time, and 13 the third time. So, yep, it's definitely.
Wow, that's significant. Excellent. Well, good. Yeah. See, I mean, we I always find that people's numbers significantly decrease, a lot of times in half, right? I mean, I tend to do like 11 or 12 and then 5 or 6. So really what it shows you is that's 1 minute of focusing on your breath. And, we may be busy people, but we can always take a minute here or there during our day to just focus on our breath. That act really just slows down the breath. And if you're doing it continuously throughout the day, just think how you can keep yourself kind of at that point where you're taking slower, deeper breaths. And again, when we take deeper breaths, we're getting more oxygen to our bodies, to our brains, to our minds. And it just helps us feel more regulated and calmer. And
Kelly, to that point, you actually had someone who shared that they got 8 both times, but that they practiced mindful breathing several times a day.
oh, there you go. Well, thank you for illustrating that point for me. And I like to do, so we have, our regular kind of team meetings every week virtually. And I always do a little bit of a wellness meditation or a breathing exercise or something beforehand. And I really like to practice these and find that it's really, helped the team kind of focus on this stuff. So I think it's helpful to share this stuff with your team and the people that you work with, even people you're supporting, just take a minute together, every a couple times a day and focus on the breath. And so when you're taking that, we call it a mindful minute. You can do either thing. You can take that minute to kind of slow down your breath, or you can count your breaths for that minute. And then you can, anytime during the day, I'm going to just stop, close my eyes and take 6 or 7 breaths, or however many breaths you took for that time. So it's just really nice to practice and easily accessible, right? It's not kind of like this long meditation that I think is tough for people to always engage with. Okay, so another thing that I love to focus on and that I think is really powerful is gratitude. So resilience can be strengthened by expressing gratitude for the good things in our lives. And, I've been practicing gratitude for a really long time, and practicing and using gratitude practices with the people that I support as well. And working with my caregivers, I feel like it's really, really important to practice gratitude. And we can do this in many different ways, right? We can, I don't know if people can see that one. Let me just see. There's like this little window. Sorry about that. I don't know if people can see this little window on the top of my slide. Am I the only one seeing that, where it says, please move this window away from the share?
I can see it as well, Kelly.
Yeah, so I don't know how to make that go away. So I apologize for that.
It
keeps coming and going. So I apologize for that anyway. Disregard that. So we can do gratitude journals, right? Which, writing down kind of the things that we're grateful for. We can, I just part of, my prayers and speaking to my higher power, I practice gratitude. We can have a gratitude jar. Positive psychology is where I pull a lot of this stuff from, and it can be really, really helpful in building resilience. And that is a type of psychology that was started by Martin Seligman, and they have programs at the University of Pennsylvania. And Dan Tomasulo is another person that has a lot of really good books on positive psychology and gratitude and mindfulness. But gratitude and the expression of gratitude in positive psychology is actually an intervention that they use. And one of the things that they say to do that really boosts our mood and helps fight depression and anxiety is writing gratitude letters. So, picking one person or a few people and actually writing them a letter about, what are you grateful for that person, and sending it to them, or a phone call, and just picking up the phone and kind of expressing gratitude to someone. It can be something that really boosts, our mood in that moment. And again, when you're practicing these things regularly, it can kind of just help us be on that more equal kind of calm kind of field. Practicing gratitude to the people that we support, I think that's a really big one that I really try to, practice regularly. I wish I could make that go away. Does anybody have any insight in how to make that box go away? No.
I wish I did. I'm sorry, Kelly.
So we'll just have to put up with it, I guess. I don't know. Okay, so some other factors in resilience and building resilience. Again, taking care of yourself, active problem solving. So when kind of these challenges and these problems come up, really think about, number one, like what's in our control and what's out of our control, and practice problem solving. What can we do about it? And doing that with the people that we support actually can be really helpful too. Meaning and purpose. I really feel like this is really important is to always kind of find the meaning and purpose in what we're doing. Maintaining a positive outlook. Again, not meant to be Pollyanna-ish and everything's rosy and, unicorns and cupcakes. And no, I mean, maintaining a positive outlook just really is recognizing that, yeah, there's challenging things. What can I take out of those challenging things? How is that growing me? How is that, making me stronger? And what can I see that's also good? Not always going toward the, that negativity bias, and what can I notice that's good. And then again, social support and connection, a little tougher during these times, but I feel like we've done pretty well with it and being creative. So
Kelly,
yep.
see if you can right click that and say exit or close. Right click on that. Does it do anything?
There's next, previous, it's not.
In show, no,
it's not doing it.
Okay, well, it was just a shot.
Yeah, thank you.
Down the bottom it says end, but I don't know if you want to do that.
Oh, it says end show. Yeah,
I don't know if that's what would do. Probably wouldn't do that.
Yeah, I'm not gonna risk that one. So
Okay.
I'm sorry about that, guys. I don't know. I guess we'll just have to.
You can't click on it and drag it off, right?
That's what I tried to do.
Yeah. Okay.
Because it says move the window away. So, no, it went to the next one. Yeah, I don't know.
Yeah. Okay. Well, it's got me then.
Sorry about that. All right. So
we just have a quick question in the chat.
Oh, sure.
Asking to talk through the difference between mindful and guided meditation.
Oh, that's really good. That's really good. Yeah. So mindfulness, and I don't know if you meaning the difference between mindfulness meditation and guided meditation. There's all sorts of different kind of ways to practice mindfulness meditation, and that really is being in the moment on purpose, non-judgmentally. So, when you're meditating, it's really just focusing on the moment. So that could be, types of mindfulness meditation are focusing on the breath, focusing on a mantra, like some kind of phrase or word that you repeat. You could kind of have a more visual, like think of colors or different things. So anything that you're using to focus on the moment, a lot of times it's breath, focusing on the breath in mindfulness meditation. Guided meditation is more someone talking you through, say, like an experience, like you're walking down a path in the woods, or you see the ocean. So guided meditations are more someone talking you through the meditation, whereas using mindfulness is more about something that grounds you in the present moment. Is that helpful? Does that make sense?
Very helpful. Thank you, Kelly.
Mm-hmm. And we'll talk a little bit about this in a minute too, but there's lots of different ways to practice mindfulness that's not related to meditation. You can practice being mindful in any moment just by grounding your awareness in that moment, right? By using your senses. You can kind of say, what do you hear? What do you smell? What do you see? You can have walking mindfulness. So you're just kind of paying attention when you're walking. And I love to walk in the woods and in the forest, and but noticing, the trees and really looking at what you're seeing. Your footsteps, really pay attention to your footsteps. Eating mindfully can really just focusing on your meal and eating mindfully. Shower, focusing on the water. So there's lots of different ways to practice mindfulness that aren't even meditation. So this is a self-care plan. Again, this one and the next one that we're going to go to are also in the handouts. And this is just one of many ways you can, create a self-care plan for yourself. So really what I like about this is just pretty simple, where it's mind, body, spirit. You're focusing on those different kinds of, those different types of ways to take care of yourself. And it's about being accountable, right? It's about writing things down, writing the ways that you want to, that you that you want to take care of yourself, that you want to practice self-care. And what I like about this is I like to do them together with people. I have done them in groups. Did a women's trauma group where I had, each woman in the group had a self-care plan, and we would bring them each week and we would talk about what we practiced that week. We kind of had a big one that we did as a group, and we would write different ideas down and we would try each other's. That was kind of cool. There's the second one here, and I've actually done them with actually some people sitting out in the audience. I've done them with people that I've worked with the members that I support and their providers and their families, kind of do them together. That can be fun. I've done them with, students that I've supervised, interns that I've supervised, people I've supervised. This one's kind of good and different in that it's a little more concrete rather than being really abstract about just mind, body, spirit. And again, with spirit, it's not religion. It's, really thinking about how do we connect with something bigger than ourselves? It could be nature, it could be all sorts of things. But this is kind of good because there's a little bit more directive, kind of less, like I said, a little more concrete. So, important people who I trust. I wish I could make that darn thing go away. I can keep my body clean by, healthy food, hopes and dreams.
Ellie, why don't you just try real quick? Try stop sharing and then just share again. And you know what I mean?
Yeah, let me
see if that does it real quick. Sorry, everybody.
That's okay. Thanks, Jason. No,
just an idea. Yeah.
All right, let's see. You know what? This is the other one.
Kelly, if you can go into your settings and disable hardware acceleration for your screen sharing, it should also fix it as well.
All right, that's confusing to me.
That's too much. I think that's too much.
Too much to do right now.
That's too much to do, Rob.
I can help you afterwards if
just
you
hit
need
from
it.
current. Yeah, hit from current slide right there.
Yeah, let me just see if this.
Hit from current slide.
Oh, did that make? I think that might have worked. Oh, so I went over to the. Okay, thank you, Jason. Look at that teamwork. Okay. All right, so that's, the self-care plan. And actually, I just want to point out that in the resource list that I had shared, the University of Buffalo School of Social Work has an amazing, website and an amazing page on creating, the development of your own self-care plan. And that's really kind of neat. It walks you through a bunch of different steps too. So check that out. So I was just looking at time, and the time is going by way faster than it was prior. So I think hopping out and having to come back in. So I might pick up the speed a little bit, and I may not get to do one of the exercises that I was going to do because we have till 11:30. Is that right?
That's correct, Kelly.
Okay. So I just wanted to shift gears a little bit here and just briefly mention, and I added in, some slides from a presentation I did on some of the things related to COVID and the things we're experiencing during COVID. So, but I'll go through it pretty quickly here. I just thought it good to mention it. So we know during this time, of course, there's just been so much stress related to what we've gone through, with this pandemic and everything that kind of all these different components and things that go along with it. But one thing I really did want to make sure and mention here is, the increase in spike in mental health, struggles for people and for ourselves during this time. This came from, a study through the CDC and Census Bureau and other things talking about, the increase in anxiety and depression. And, January, May, and December of 2020, and how we look at the rise in anxiety and depression during this time. And I'm sure we can all really relate to this. And, for the people that we support as well. So I think we just really have to know that this has been a time of struggle. And I think we are seeing a light at the end of the tunnel. So what's a piece of this stress, right? That I think there's a lot of people out there, and maybe not everybody, but that during this time has had to use technology a lot more. And, there really is this thing called tech fatigue. I like this little cartoon. It's a classic case of tech fatigue, right? Excuse me. So I just think it's good to mention that. So what is tech fatigue? Let me just, okay. Tech fatigue is mental fatigue and exhaustion that comes from the frequent use of technology. It's also called techno stress. So this is one of those terms that's going to come out of all of this. You know, it'll be in our history books. It's characterized by physical, emotional symptoms of stress resulting in the use of technology and the frequently looking at computer screens. Of course, physical symptoms, headaches, backaches, eye strain, neck pain, stiff shoulder, joint pain. Again, I'm sure there's many more. You know, mental, emotional symptoms, mental fatigue, depression, nightmares, panic, helplessness, trouble sleeping, loss of temper, you know, all of these kind of things. Frustration, errors in judgment. What can we do about this, right? Well, first, we really need to recognize it. We need to be taking regular breaks. We need to shift our awareness into our bodies, like how we did with the breath. And if we can limit ourselves with the use of our devices and put a little bit of boundaries on it, not everybody can do it, but say, I'm not going to look at my phone or my emails before 8 or after 6. You know, try to do that as much as we can. Take technology vacations, you know, days or weekends may be a lot, but maybe a few hours. Make sure we're cultivating habits. You know, in my household, we've done a lot of increase in spending time outdoors, in nature. We've done a lot of rock painting, and people can see this fun rock I painted. You know, we've gotten some great books on painting rocks, and we share them. We might leave them in parks or share them with people. Find ways to connect with the people in our household, games, you know, visits, that kind of thing. Again, we're coming to the light at the end of this tunnel, but just still, you know, stuff to keep in mind. Mindfulness, meditation, you know, again, practicing mindful walking or even eating, and exercise and spending time outdoors. And then quickly, again, I'm going to go through this because I thought it was important to mention, is Zoom fatigue, which is a real thing. And there's been a lot of research done on this. You know, so video chatting requires more from us than face-to-face. We need to work harder to process like nonverbal cues and body language when we're looking at a screen. Paying attention to those things consumes a lot of energy. Our minds, it's like a weird thing where our minds are together, but our bodies are not. And it's kind of just weird for our minds to process that. And it can have feelings of confliction, you know, conflicting feelings, and makes us really tired. And it's tougher and more challenging to relax into conversation. And then there's more contributing factors, of course. You know, this is an interesting thing that they found, is that silence or delays can cause anxiety. So the studies show that 1.2-second delays in conference calls or videos made people perceive the responder as less friendly or focused or disinterested. So that's really different when we're talking with someone, when we're face-to-face with them. You know, some silence, I think, is normal, is typical, whereas they find in video or virtually that it really does cause this anxiety. And then, of course, we are more aware and being distracted by our own physical presence. You know, when we're in meetings or talking with someone, or, you know, face-to-face with someone, we don't see ourselves. Whereas when we're on a Zoom meeting, you're watching yourself, you're seeing yourself, and that can create kind of this performance anxiety, which can be really stressful. And then we're multitasking, right? We're on our phones when we're on meetings. I'm sure people are doing it right now, which is totally fine and makes sense. We're checking email, you know, we're doing a bunch of things. And then there's this thing, you know, this self-complexity theory where we're practicing more than one role in the venue, you know, so we're not at home, we're not just, you know, mom or wife or partner, or, you know, we are also, you know, now we're working. So we have all these different, and that's kind of, you know, it's collapsed where it's all the same. And then we're navigating outside distractions. You know, we have the kids and the cats and the, you know, things kind of distracting us. And then how do we alleviate that? How are we doing on time? Oh, I wanted to have some time for questions. We can try to limit video calls and, you know, stuff like that. Turning off the cameras, you know, should be optional at least sometimes, I think. Focusing on the speaker and try to limit multitasking. Having your screen to the side sometimes can help. It makes you feel like you're in an adjoining room, can be less tiring. And build in transition times, you know, take time between meetings to go out, stretch, take a breath of fresh air. And then creating boundaries or buffers between work times and personal times. I like to kind of clear my space and move my stuff and, and take a breath, maybe step outside. Again, practice good self-care for prevention. And then practice self-compassion, which, I was going to get into a little bit more, but I really like this quote by Kristen Neff. Self-compassion is a way of emotionally recharging our batteries. Rather than becoming drained by helping others, self-compassion allows us to fill up our internal reserves so that we have more to give to those who need us. Jack Kornfield also has a great quote that says, if compassion does not include ourselves, it is incomplete. So we need to remember to, be compassionate toward ourselves. And Kristen Neff is a wonderful researcher, author, educational psychologist, professor, and she does a lot of research and has written lots of books on self-compassion, and she's great. I just wanted to mention equanimity too, because there's this Kristen Neff video. We're not going to get to do it, but equanimity is mental calmness, composure, and evenness of temper, especially in difficult situations. So maybe I can even send this link, or if we get the PowerPoint, you guys can try this on your own. This is Kristen Neff doing it's a 10-minute little exercise on creating equanimity and, for caregivers and self-compassion for caregivers, and just really remembering that we're human, that we have to remember that we can do all that we can do, and we want to help people and support people the best we can, but we have to know that we are human and we may not be able to, change every situation in the way that we wish we could. We just have to remember our humanness. Whoops, it's gonna start. I didn't mean for, okay. And then just to end with, I think it's important for us to remember that we have to have hope, right? And not get lost in all of this, and know one of my mom's favorite sayings is, this too shall pass. So, I just think that holding on to hope, and that's also a big part of positive psychology, is the study of hope, is really important. So I'll end with that, and it's 11:29. This is some references and, resources and some places I've gotten some of this information from, some good books and websites. And this should also have been shared with you, or will be shared with you, so you guys have these. But I did want to, I don't know if we can go a few minutes over if there's any questions or comments or thoughts people want to share. This all didn't take as long at all when I was practicing.
So Kelly, we'll definitely give it a couple more minutes, and if folks want to put their questions into the chat, then Carrie and I can go through those. People are certainly appreciative of your time today. We will be sending off resources again to the group in email, including the PowerPoint presentation. So that will be forthcoming in an email later today.
Great.
And so as people are putting their final comments into the chat, no questions right now, Kelly, but lots of thanks for the work that you put into this today. We'd also very much like to thank you for participating in the 5th annual summit. Technical difficulties and all, you rolled with it. We appreciate it and everybody's patience. We'd also like to thank today's sponsor, Borowski Insurance, for sponsoring Kelly's webinar. We hope to see many of you back this afternoon. We have a second webinar today, Managed Care, Where Are We Now, with presenter Jeff Kielson, Vice President and Strategic Planner for Advocates.
I just stopped my screen so I could see the chat now.
Yeah, no, that's great. Everybody's really just very thankful for the information, for the presentation. I think it's all very timely. And most, if not all of us, can relate on so many different levels of everything that you shared.
Yes, and thank you all so much for taking time and being here, and just take away and remember to be practicing this kind of stuff for yourselves, and taking care of yourselves, and putting yourself first in lots of situations. I really appreciate the time, and I hope you guys all have a really good week and a good rest of the summit, and maybe next year we can all actually be together, which would be nice. Yeah, very relatable. It is. Yeah.